My name is Tony Amato. I'm with Discovery Communications. I'm Vice President of Global Benefits, and I came to the conference to participate in a panel discussion on employers' view of healthcare, quality of healthcare around the world, and how do we improve on that for our employees. Yeah, I think it's in the early stages in our spectrum. We have, a relatively mobile workforce, so it's of interest to us because we have people traveling all throughout the world, and medical care and the quality of medical care is critical. Medical tourism is important because as the world becomes less and less compartmentalized, even regionalized, we're seeing those barriers dropping quicker and quicker, that things such as medical tourism and where you get your care, whether it's Canada, Singapore, the United States, Great Britain, Russia, they're all going to have the systems and tools to provide excellent quality medical care. Healthcare reform is going to affect virtually every employer. Small, large, it has dramatic impact across the healthcare spectrum. Providers, insurance companies, everybody will be impacted by it. Employees, family members between now and all the way out through another 6-7 years. Predominantly in terms of the government's request to have major plan sponsors or plan sponsors companies really take on additional burdensome administration as well as reporting, and then the design of the plans and the options for employees to get into exchanges in a few years from now will have a dramatic impact on healthcare plans that employers sponsor for many years to come. Okay, I see medical tourism moving more into the mainstream in the next few years to come. And I think it's something that employers are going to really need to pay closer attention to, in particular given what's going on with healthcare reform and the cost impositions that's going to impose on their plans. Medical tourism could very quickly become a common means by which employers and even people just seek medical care. I think some of the biggest concerns we might have right now are around the contingent liabilities, if you will, in terms of family members who might be in one country while somebody's seeking and receiving medical care in another country. And what are the obligations of the employer, not just to the family members, but from a financial standpoint to the employee. And the other side of the coin is if something went wrong, then the repatriation process and the costs and the liabilities associated with that. So some of the legal sides of this probably need to be fine-tuned before it becomes more mainstream. I think having an association affiliated with medical tourism is critical because there needs to be a concerted effort and voice speaking about the industry and where it's heading, and helping to gain the momentum that's going to be necessary to do it. If it was fragmented and left to different groups, I don't think it would really get the traction it needs to become part of the mainstream solution. The conference has been great. It's really enjoyable. You get to meet people from all over the world, whether they're providers, physicians, employers. The networking capabilities are tremendous. There's plenty of time to get to meet people and introduce yourself. And I think the people who sponsor this do a phenomenal job. It's well worth the time and effort to be here.